If a doctor diagnoses a patient, for example, with cancer,
Yeah, we don't want to give that.
we don't want to give that information.
Yeah,
You
I
want
ran
the
into that
doctor
one
to be
too.
the one to explain it because it's a medical diagnosis. And then after they've explained it and the degree, then you may be able to reinforce it. I always find it tricky if you're not the one there when the doctor's explaining to then go ahead and reinforce. But I always like to ask the patient, well, tell me, what has the doctor told you so far about that?
So you
What do you know about it? And then once they start telling you, you might find out that they know a lot of information or that they don't really get it at all. And then you can be an advocate and call the doctor and say, I really think you need to come back and re-explain that.
Correct.
And if you find that they know a lot about it, then maybe you can explain more yourself because you feel comfortable that they already know.
So
But
it's
yeah,
wrong.
I think that was very wrong.
Very wrong, right?
And I
Yeah,
don't know.
after that, poor Anna was so bad, like, she was in denial and, you know, learning this new.
And how did the patient say anything?
Well, he was having his seizures, so he was out of it, and then he became very aggressive.
Yeah, that just creates a difficult situation for everybody. So this was another question. A nurse is debating whether to receive report in the patient's room or in the hallway at the very beginning of a, or it's not a, yeah, it is a question, at the very beginning of a busy shift. Which item response displays the correct result of reporting at the bedside?
C.
Right? It improves report accuracy, reporting at the bedside. So I read another research study, and it said that bedside report may be the most important initial step of providing care for your patient that shift. It has a very positive impact. It includes safety, advocacy, and collaboration. It's an efficient way to transfer information that includes the patient, patient-centered care, right? There was a nurse in this article that floated to a new unit, and she was literally debating whether or not to get report at the bedside. She was new to the floor, and then she decided, you know what, I just want it at the bedside. So they went into the room and gave it at the bedside. Luckily, she did that because the patient was deteriorating. When they came in the room, the patient was in respiratory distress. And they both worked together, and they helped the patient. And in reflection, she was saying, oh my gosh, what if we would have given it at the desk? I would have never known that patient was deteriorating. Who knows what state they would have been in by the time I got there, and I wouldn't have had somebody right there to help me. So that's like a really realistic benefit of giving bedside report. And we really are trying to advocate bedside reporting here at this hospital. So I like this little picture. It empowers families, it empowers patients, and they get to have a say in their healthcare decisions. Now, the type of bedside report that they like to use is situation, background, assessment, recommendation. I don't know if you've all heard of that. There you go. So a situation is a statement of the problem, clear, brief, and concise. Mr. Jones has multiple prescriptions of Coumadin in his home, and he is unclear as to which one he is supposed to take. You want the background to be pertinent, brief, clear, relevant, and related. Considering diagnosis, prescribing physicians, dates, and dosage of medications. I know you guys have covered all that when we discussed it, right?
Mm-hmm.
Assessment, you want to analyze, give them your considerations, what you found, what you think, maybe a professional conclusion statement. And recommendation, what is it that you want? What is it that you're asking for? What do you recommend? What are you requesting to have done? So for example, please clarify which is the correct dose of Coumadin for Mr. Jones to take and which physician will be responsible for managing his anticoagulant therapy. And then I was going to have you guys flip that page back over that I gave you to write on and read a little scenario. And then I'll just pick one of you guys, unless you all want to do it, just to kind of, from that information, give a little report on that patient.
Code White, dialysis.
Code white dialysis. Code white dialysis.
So code one's rapid response.
I know, it's one of them. Yeah, so the rapid response team is going there right now, for Code White.
Which is the nursing supervisor, respiratory therapy, maybe a resident.
Maybe lab,
Oh, yeah, lab and x-ray.
X-ray.
What does that mean? Like, I know it's rapid response, but
So Code White means that the patient is, like, something is going on with the patient that they're not quite sure what's happening and they need help.
maybe
They're-
like this patient?
Yeah, and they're afraid, like, it's not a Code Blue, but it's headed that way. That's what they're thinking, so they need help. And they wanna try to figure it out fast before it gets that bad. So the Code Blue team really goes, but they're on Code White status.
Oh,
But that way, if it turns into a Code Blue,
they're there.
they're there, ready to go. And it's the house supervisor, it's usually an ER nurse, ER physician, lab, X-ray. Of course, the primary nurse has to be there, the charge nurse has to be there. And I've seen the directors go too, like the director of that floor will go. Maybe anesthesia, whoever's kind of nearby, sometimes they'll go too, just to be, they'll kind of wait outside the room and see if you need extra help, where. I think
Yeah.
Susan ran to the ladies' room, did you guys want to take a little break?
Yeah, I triaged everything like I was in
Okay.
ER, so hopefully I got that right.
Let's take like a tiny break and then we'll go over it.
Okay.
And then we're just about done, yay.
It's a GI bleed. You can talk, because you can't claim nothing to get him, and then he had sympathy, he had this and this. And then he got his vitals under stable, and then he became tachycardic, and low blood pressure, became tardy stools, he's on NSAIDs, and all that stuff, just
Uh-huh.
leading to the GI bleed.
Okay.
That's what, I could be wrong.
You could be wrong, I could be wrong, we could all be wrong. We're just gonna go over it.
Yeah.
Everybody decide, take a break. Five minutes, right?
That's fine.
So who employs the dialysis nurses here? Are they employees of the hospital, or do y'all have a, like DeVita, one of the dialysis?
They're the hospital. And it's the same director, Diana, she's
Uh-huh.
the director.
Oh, okay, makes sense. Since she's ICU and Kelly.
Yeah.
So are those her three?
It's, yeah, she has 3 hats, right? ICU, tele, and, you know.
She's from Ohio.
Right? Did she tell you how long she's been here? I'm not even sure.
May.
May? Oh, that's all? Oh,
8 months.
8 months.
What she said. It's only been here 8 months.
And she came right from Ohio.
Yeah, but I'm not sure she came here because of the job or if she was moving here. I haven't asked her.
Right? Like if she's gonna stay or.
But I probably will, just for the fact that I'm not from here and I ended up down here. It's kind of, you know, who knows?
There's a lot of people here that are from here.
Yeah, I mean, so
Me, you, her.
who knows? She may have family that comes down here in winters and she liked it, or, you know, I'm gonna ask her.
When I was in nursing school and then I came here, one of the girls from nursing school, her grandma came here every year, and so one year when she came, her grandma brought her with her, and we went out for coffee or whatever. It was like, oh, wow.
I mean, that's how I ended up down here, is that I was doing a travel assignment between Galveston and Houston, and a nurse that used to be a traveler that went staff in Louisville that I worked with, her mom and dad always wintered down here.
Uh-huh.
And then her dad had passed away, and her mom decided that she was gonna come down here full-time from Missouri. And so Rhonda decided that she was gonna move down here to be near her mom. And I came down here to visit one weekend and really liked it, and came back like 2 weeks later to find a place.
Wow.
And so when my assignment was over, I moved down here.
Let me just close that door.
Oh, sorry.
It's already like loud with the door closed, right? Especially when the carts go by. You're fine, you didn't know which door that one was gonna come in.
Yeah, that's what I kind of,
Yeah. Okay. You guys had a break? Let's see. So Rita, which scenario did you get
I got a patient with NMI.
with the MI? Okay. So pretend you're calling the doctor. What would you say? That's basically what we're gonna do. We're gonna go through the situation, background, assessment, recommendation. Or do you want Juan to go first?
No, it's fine. I
You're
mean,
fine?
I'm
Okay.
completely new to calling
Yes.
or giving a report.
So this
but
is good for you.
Yes, so my situation here, I have Miss S, a 72-year-old. She came in on, doesn't have a date, but she's been here 4 days complaining of chest pain. Her blood pressure was at 90/52, it went down to 80/52, and her oxygen is at 91%. And she's very anxious, and I gave her 1,000 cc's of, it doesn't say here, but.
Of IV fluids,
Yeah,
right?
IV
It doesn't say what
fluids,
kind.
So that situation basically, well, I already gave them the abnormal, right? So, and what I did,
So you did,
background,
I think you did situation, background, assessment,
recommendation.
or what do you
Oh,
want?
no, and very important, she also just took a nitro.
Very good.
Very important, she already took a nitro, she's on fluids.
At her EKG shot.
They placed her on, doesn't say that though.
That does.
She had a PCA regardless of anything.
What does her EKG show?
Oh, yes, it's an ST change,
Right, ST changes,
ST change.
and what's her heart rate?
Heart rate at 120.
And her vitals, like 36, 85% on room air. And then, when you said it went down to 80/52, and then on 2 liters, it's 91%. She's anxious, you said. And then, so recommendation, it's like, what are you asking the doctor for? What are you wanting from him?